those of you that are new to our webinar series, my name is Joe, and I'm the Foundation Program Coordinator here at the Riverside Medical Clinic Tribal Foundation. We are a nonprofit organization based in Riverside, California, and what we do here at the foundation is we strive to better the health and well-being of our local communities. So that's going to be local, so health communities here. We do that by various different ways. So we do webinars like these. We also do health lectures and events, and we also do anti-bullying and bullying prevention work with local schools and communities out here. So today, in honor of Nutrition Month as well, I want to go ahead and welcome our guest facilitator today, Paula Doebrich, who is a registered dietitian nutritionist practicing out of New York State. She has her own private practice as well called Happy Nutrition. So I'll link all of her information in the chat box as well. So if you want to get in contact with her after this lecture or this event, you'll have access to do so. And with that, I'll go ahead and give it away. All right, so yours, Paula.
Okay, hi, thanks for the intro. I'll start sharing my screen so you can see my presentation. Okay, so there we go. Can you see my screen? I hope.
Yes, we can see it.
Okay. Great. So this webinar is about endometriosis and nutrition. And so just briefly what we're going to be talking about, I'll introduce myself and then we'll get into the basics of endometriosis. I think most of you are probably pretty familiar with what it is, but just in case somebody is here for purely informational or educational purposes, I'll touch briefly on what is endometriosis, and then common nutrition recommendations that are made, and we'll get a little bit in the details of what's behind those. We'll have a brief summary, and then I also try to leave plenty of time for Q&A because I'm sure you'll have some questions for me at the end. So about me, I am German with Polish roots, in case you were wondering where this accent is from. My parents are Polish, but I grew up in Germany and was also born there. And I moved to New York in 2018 to pursue a degree in public health nutrition, as well as my registered dietitian certification that I completed at New York University and Hunter College here in New York. And nutrition is actually my second career. I had a career as a model before that for almost a decade. And it is partially why I got into nutrition. All the questionable recommendations that were constantly made for me as to how I can maintain appropriate body size for the modeling industry were really getting to me, and I started questioning those and looking things up, and it became very interesting for me to see how a lot of the recommendations that are made really have nothing to do with health. And so I became a dietitian because I wanted to help others understand how to be healthy without really compromising, or how to feel good and look good and all these things. Then a fun fact about me is that even though I'm a dietitian and a nutrition expert, I am a picky eater. And it really helps me to kind of understand where my clients are coming from when they refuse to eat certain things or are just not open to trying some things. And it really helps me be a little bit more compassionate there. Okay, so let's get into the presentation. Endometriosis affects an estimated 1 in 10 women during their reproductive years. And it is, patients with endometriosis have endometrial type tissue outside of the uterus. And that causes some symptoms that are, that can range from mild to extreme. such as excessive menstrual cramps, abnormal or heavy menstrual flow, and pain during intercourse. The causes of endometriosis are still not fully understood, which is also why it is a little tricky to really find cures, simply because the causes are not fully understood. It is treated mostly through managing the pain. Watchful waiting is one of the things that are done. So you just wait and see how it develops and how bad the symptom gets. Pain medication and hormone therapy. And then as a last resort, surgery is often done to remove that tissue from outside of the uterus that is causing the extreme pain and symptoms. Other things that are often recommended are, again, ways to manage the pain really. So relaxation techniques, meditation, warm baths, having regular bowel movements has been found to help ease pain and symptoms, regular exercise, hot water bottles, heating pads, acupuncture. So you can see a lot of these things are really just managing the symptoms and the pain. And now the big question, can diet help? There are no official dietary recommendations for patients with endo, but there are a lot of things that are recommended when you look up diet and endometriosis. So some of the popular recommendations include following a low-fat diet, high fiber intake, elimination of foods containing soy, gluten-free or dairy-free diets. So these are the things that are commonly recommended. There's much more out there, but we will try to address all of these and kind of talk about them. I really liked this quote that I found in one of the research studies that I was reading that I think will be good to guide us through this presentation. And it says, although no specific dietary adjustment was found to increase quality of life, endometriosis patients do feel that dietary adjustments have a beneficial effect on their symptoms, meaning that a lot of people, even though maybe research isn't able to confirm the mechanisms, a lot of people do feel that making changes helps them. And with that in mind, I want to quickly just mention about nutrition research, because whenever you find a source online and a recommendation online, it will likely say something like, research has found, or this study confirms that XYZ helps. And a lot of my education in my career has been about nutrition research. And I know that nutrition research is one of the most challenging areas of clinical research, simply because it's incredibly hard to control for many factors. And many of these studies don't reflect real life settings. And often correlations and causations are established where they really shouldn't be. So you could prove that eating fruit will increase your chance of getting into a car accident. However, what wasn't taken into account is that the fruit stand is just at a very dangerous crossing. So you really have to look into all the details and how applicable is this research to a real life setting. A lot of the research is done in animal models, which really is not applicable to humans. It's usually just seen as a preliminary finding that will guide future research. Single nutrients cannot represent a whole dietary pattern, and they're often grouped in a poor way where some foods are grouped together that really are not the same, they don't have the same effect on our health. And then overloading on a certain nutrient, no matter if from food or from a supplement or pill, will always result in some extreme findings. So a lot of the research that you read when it comes to specific vitamins, people just take a very high dose, and that's just not what happens when you eat that food. So with all of this in mind, let's get into all those recommendations that are made for people living with endometriosis. One of the big ones that is recommended is eating a low-fat diet. And the theory behind it is that endometriosis as an estrogen-dependent disorder we'll be able to control it better if we eat a low-fat diet, because eating lower fat is associated with lower levels of estrogen. This is mostly based on biochemical processes and the knowledge we have from that, more than research that was done in people where we were able to see that result when they were following a low-fat diet. So it's more of a theory than something that was confirmed. And when I was looking for some evidence, I only found one study that really managed to show a clear correlation. And then when you looked at the study, it actually only looked at red meat consumption and then was quoted as something that proves that low-fat diets work. But we know that there's many more foods that have fat than red meat. And that leads me to not all fat is the same. So just eating low fat might not be the best intervention. And keeping in mind that endometriosis is a chronic inflammatory condition, we want to make sure that we eat plenty of foods that help us lower inflammation. And many oils are anti-inflammatory. For example, omega-3 fatty acids, which are found in foods that are high in fat, will help us lower inflammation. Omega-3 fatty acids are one of the most powerful anti-inflammatory foods. And one study was able to show that people with higher consumption of omega-3 fatty acids were 22% less likely to develop endometriosis. And 22% might not sound like a lot, but in that study, it was a pretty significant number. So these omega-3 fatty acids are found in a variety of foods. Mostly fish and seafood are excellent sources. So the fatty fish like salmon, mackerel, herring, sardines, oysters. But there's also plant-based sources such as flax and chia seeds, walnuts, and edamame. So all of these foods are going to contribute to increasing omega-3 fatty acids and are associated with lower inflammation, and they're all high-fat foods. And speaking of oils and fats, I know there's a lot of information when you visit the internet out there about vegetable oils being very inflammatory. And especially in recent months, there's been increasingly alarming messaging around vegetable oils out there. Vegetable oils are rich in poly and monounsaturated fatty acids, which are generally beneficial for overall health. They are the so-called healthy fats. And when consumed as part of a balanced diet, they are generally connected to better health outcomes. There's currently no real evidence from population studies that people who eat those vegetable oils as part of a balanced diet have higher inflammatory markers. One problem with such findings, the assumption that vegetable oils are inflammatory, is that vegetable oils are often used in highly processed foods. And so if we take that assumption, of course, people with a higher consumption of highly processed foods are going to have worse health outcomes. But if we just use some canola oil as part of a balanced diet, they are unlikely to increase inflammation. The next recommendation that is often made is a high fiber diet. Fiber is believed to help reduce blood estrogen and lower blood insulin levels, and lowering those blood insulin levels will also help reduce estrogen levels. High fiber foods also can help prevent constipation. And they are also good for our gut, which we now know that poor gut health is often a reason for inflammation or higher levels of chronic inflammation. And then high fiber foods are often sources of beneficial antioxidants that will also help reduce inflammation in the body. And I know antioxidants is something that is trending. It has been for years, but I find with many of my clients that when we actually get into it, they aren't sure what antioxidants actually are. So we just know we're supposed to eat a lot of them and that they're superfoods, but what are they? So antioxidants are powerful plant compounds that can lower inflammation. They work to protect us from toxins that we either are exposed to from the environment or even produced as part of processes in our body. And so these compounds are there to kind of fight all these harmful substances that are being produced. They are not as hard to get as it might seem. Antioxidants are really all the colors that you see on fruits and vegetables, the reds and the pinks and purples, even white pigments in fruits and vegetables are antioxidants. So if you eat plenty of fruits and veggies and maybe some dark leafy greens, you should be getting a lot of antioxidants in your diet. That is especially true if you're eating some raw fruits and veggies because some of them are pretty unstable when we heat them. But not all of them are destroyed with heat. So, and then some more fun foods such as dark chocolate or coffee are also sources of antioxidants. So you don't necessarily need supplements to get antioxidants in. The next recommendation that is often made is avoiding soy, and it seems to make a lot of sense because soy contains phytoestrogens, and phytoestrogens are plant compounds that can mimic estrogen. So of course, we don't want anything that will further increase estrogen or mess with it in any way. But again, this is based largely on just a thesis that we were not able to support through any research done in populations or people eating soy as part of a balanced diet. So far, what we know is that phytoestrogens do not seem to bind to estrogen receptors in the same way as estrogen does. And there was a lot of research done in breast cancer patients, and breast cancer is also estrogen dependent, so it is an appropriate comparison here. And they found that phytoestrogens may actually have an anti-estrogen effect, and in populations who consume diets high in soy or consume soy as part of a balanced diet, they seem to have less breast cancer and estrogen-dependent diseases. There's some preliminary research that was done in endometriosis patients too, and it seems to be that really soy is not the same as just eating estrogen in a synthetic form. And soy can have many benefits and actually lower the risk of disease. And speaking of soy, plant-based diets is something that is often recommended, probably because plant-based diets usually are low in the foods that seem to make symptoms worse, such as red meat, and high in foods that improve symptoms, such as fiber, fruits, vegetables. The problem is just that the definition of a plant-based diet varies. So nobody's really sure what is meant by that, because plant-based could mean anything from a 100% vegan diet to simply replacing some of your protein with a plant-based protein, such as soy. And including more vegetables and fruits and replacing some meat with plants is always beneficial. It will increase your consumption of fiber and antioxidants. But cutting out plant protein completely might be counterproductive. And that's because there are some important nutrients, especially with endometriosis in mind, that might be missing from a fully plant-based diet. So these nutrients include B12, calcium, vitamin D, zinc, iron, and probiotics. All of these nutrients seem to be important to get plenty of in reducing endometriosis symptoms. And hand in hand with the plant-based recommendation, dairy-free diets are also often recommended. Dairy is often blamed for worsening symptoms. It's often claimed to have an effect on hormones and to be inflammatory. However, dairy is an excellent source of vitamin D and calcium, and those two nutrients, especially when eaten together, seem to reduce inflammation. And one study found that women with high vitamin D plasma levels had a 20% lower risk of endometriosis than women with low plasma levels. Then a side note on lactose intolerance, there seems to be a link between poor gut health and endometriosis. So many endometriosis patients do suffer from digestive issues. So some diagnoses are more common, such as lactose intolerance. However, that doesn't mean that if you want to include dairy in your diet, you couldn't, because just having lactose intolerance doesn't mean you have to cut out dairy completely. First of all, there's many products on the market that have the lactose removed, such as lactose-free milks and yogurts and all these things. Many cheeses have virtually no lactose and are often tolerated by lactose intolerant patients. Fermented dairy products such as yogurt or kefir are often tolerated and cause no symptoms. And then for those people who want to include dairy and avoid symptoms and are more sensitive, they can always take lactase, which is the enzyme that helps us digest dairy, which is missing in people with lactose intolerance. And kind of piggybacking off of that, not all dairy is the same. So again, a problem with really interpreting a lot of nutrition research and what were they looking at, what kind of dairy are we really talking about, and did people just eat highly processed cheese-like products and ice cream and sugary yogurts, or were they eating low-fat dairy, real cheese? So that's a question we sometimes have to ask, and we can't really just throw all dairy in one basket, because of course there's products that contain dairy that are not very beneficial for overall health. But throughout all nutrition recommendations, no matter which organization you look at, it is recommended to include low-fat dairy into the diet for best health outcomes. Of course, you want to limit the intake of saturated fat, but choose lower fat alternatives. Fermented dairy is a true superfood, if you want to say so. It has a lot of beneficial nutrients and helps with gut health, and that helps protect you from inflammation and many other diseases. And eating dairy in combination with high fiber foods can also be beneficial, because the fiber will help bind the fat and help get rid of that fat that you don't need, especially the less beneficial, the bad cholesterols. And speaking of dairy and gut health, a healthy gut again, decreases inflammation, protects us, is linked to a better immune system. There's a lot of research coming out on how much gut health really matters for overall health. And like I mentioned, dairy products are excellent, especially fermented dairy products, are excellent sources of probiotics. But I also want to mention the importance of prebiotics when it comes to gut health. So on the left side here, you have the probiotic foods, yogurt, cheese, and pickles or tempeh if you want some plant-based alternatives. And then prebiotics. They are fibers that the bacteria in your gut use as food, and you can't really have good gut health without those fibers. Throughout research, we always see that people with the best gut health have a diet that's rich in prebiotics, in fruits, vegetables, whole grains. Foods like garlic and onion are very high in prebiotics. And that brings me to the next recommendation, which is the recommendation of gluten-free diets for endometriosis patients. And I didn't really understand why this claim is being made, and I tried to find something, and there really is nothing out there that would help us understand why gluten-free diets are supposed to be beneficial. A gluten-free diet will make your diet less diverse. You will be limiting the amount of fiber you're getting, and you will be cutting some prebiotics out of your diet, which is also not beneficial. And the claim that gluten will increase inflammation is not true for non-celiac patients, so people who do not have gluten intolerance. The problem with gluten-free diets is also that sometimes we fall for the assumption that just because something is gluten-free, it's automatically better for us. And we forget to think about the fact that the gluten will have to be replaced with something. So there will be a lot of added ingredients in gluten-free products. Gluten-free breads have a ton of additives that are not necessarily good or bad, but it's just something that you could avoid by simply purchasing whole wheat bread, a sourdough, or something like that. And again, if there are any digestive issues present, then fermented bread products such as sourdough are easier to digest. So it might be something worth trying. Other things that are beneficial is limiting caffeine and cutting alcohol. That is something that is pretty consistent throughout research. Then there's other nutrients that might help that I'll get into in a second, and possibly trying a low FODMAP diet, which many of you might have heard. So the beneficial nutrients that I wanted to briefly mention, because they weren't part of any of the other recommendations, but they might be very important for management of symptoms, are magnesium and zinc. Those two minerals might help relax muscles and regulate the cycle. So magnesium is found in foods like whole grains, oats, dark chocolate, and dark leafy greens. And then zinc, one of the best sources of zinc is oysters. Then we have nuts and seeds, beans, and dairy products. Kind of again highlighting how a balanced diet that includes all foods might really be the way to go, because you're getting all these nutrients in without really trying when you include all foods. And now to the low FODMAP diet. So FODMAPs are certain carbohydrates that are digested in a way that will make certain symptoms of IBS worse. IBS is irritable bowel syndrome, and patients, I've mentioned before that patients with endometriosis seem to often struggle with poor gut health. So they're 2 times more likely to be diagnosed with IBS. And that's why a low FODMAP diet might be beneficial for those diagnosed. And another benefit of the low FODMAP diet is that if there are some digestive issues, this diet can really help with identifying trigger foods and finding what really works for you. But just a word of caution, please don't attempt this diet on your own by just Googling how to do it and what foods are low in FODMAPs, because the diet is meant to have 3 stages. And most people get stuck in stage 1, which is really not great. So the first stage is elimination of all FODMAPs, so foods that are high in certain carbohydrates. And then stage 2 and 3 are the more important ones, where you reintroduce foods that are high in FODMAPs into your diet. And you see how you react to those foods. And so the second stage of the diet is really a lot of work and a lot of trying to listen to your body and seeing how you respond to certain foods. And it is meant to help you figure out how to enter stage 3, which is maintenance, where you're supposed to eat most of these foods, but just be able to know how much you can tolerate, which foods are absolutely off limits. And following stage 1 of this diet, which includes total avoidance of all FODMAPs, is really not recommended. It will make symptoms worse. And it will result in a diet that's extremely unbalanced and really not very healthy, because you have to cut out a lot of foods. And quick side note, I think it's always important to remember, as a dietitian, of course, I think nutrition is amazing. But other lifestyle choices matter just as much, if not more. I always tell my clients, you can have the healthiest diet ever, the perfect diet, whatever that means. But if certain other areas of your life are out of balance, it won't do much. So, for example, physical activity seems to be extremely helpful for many patients with endometriosis. It may help reduce inflammation, and then light exercises like yoga, stretching, and they help relax muscles. And a lot of research has seen that people who exercise regularly seem to experience less pain. A clear link still is not clear how that works, but it seems to work for most people. So that's something that might be worth trying. And another problem is also that stress has a huge impact on our health. So chronic stress affects pretty much all systems in the body. It can cause headaches or increased pain in general, high blood pressure, changes in your appetite, sleep disturbances, more inflammation, bloating. All of these things will obviously make your symptoms worse. So managing stress is another extremely important approach to endometriosis and health in general. So to sum up all of this, I took another quote from a research study, circling back to what I started with, and it concluded that participants experienced an increase in well-being following their dietary and lifestyle changes. What that means is that there was nothing specific that was able to make a difference in a significant way research-wise, or that makes sense, but people who find something that works for them seem to feel better. So only you know what's best for you. You should feel free to try a few dietary approaches and see how you feel and what works. But it is important to not feel pressured to stick to something that's not working. A lot of people with chronic disease try to hold on to dietary changes as a solution too much, and they forget that food is much more than just fuel or medicine or whatever you want to call it. Food is also a source of enjoyment, an opportunity to connect with others. It's tradition, it can be comfort. And I think as somebody who suffers from a chronic disease, you should let yourself enjoy food without feeling the added stress of having to follow something that doesn't work for you and is supposed to work on paper, but it's not. Each person is unique, has unique needs, and it will be extremely important to find a practitioner who really supports you. So if you found something that works for you, somebody who can guide you and understands you and kind of puts your needs and how you feel your body and experience your own pain over what is supposed to be right or wrong, because there is no right or wrong when it comes to managing your own pain and your own disease. General recommendations that can be made and that might help most people are limiting red meat and processed meat consumption, limiting fried foods and processed saturated fat, and decreasing alcohol and caffeine consumption. And again, you can see most of these things says limit, decrease. A total avoidance is probably not necessary for most people. Eating something every now and then will not make or break your health. And with many of those things, it also matters how you eat those foods. So are you eating red meat as part of a vegetable dish with many high fiber foods? And are you eating saturated fat as part of a balanced meal? Or are you eating something that's completely deep fried with processed cheese and sugar and fat? So it really depends. And again, once in a blue moon is definitely not going to make a significant impact on your health. And then things that you can add that are likely beneficial for most endometriosis patients are high fiber foods, adding anti-inflammatory foods, plenty of vitamin D rich foods, fruits and veggies, maintaining good gut health, and then if appropriate, trying a FODMAP diet for management of IBS or other digestive issues and identifying those trigger foods. So to sum up all of this, there's no clear link between endometriosis and nutrition. A generally healthy diet rich in fruits, veggies, whole grain, healthy fats, and lean protein is generally recommended. And most patients find their individual diets that work well. So it's important to really listen to you over what somebody on the internet says has to work for you. Try a few things, find somebody who's able to support you through whichever lifestyle change you would like to try. So for example, if you decide you want to go fully vegan because that's how you feel best, find a practitioner who will support you in getting all the nutrients you need while eating this diet that makes you feel good. And then also keep in mind that other lifestyle factors are just as important as nutrition, managing stress, getting plenty of rest, getting some exercise in. All of these things are going to have a significant effect on your overall health and managing symptoms. So if you want to learn more, if you want to reach out, if you need some support, I think my information is going to be available for you to contact me. You can schedule a free call with me. I offer them to all my potential clients where we just kind of connect and chat and no strings attached. We can just see how we can best work together and if I can help you. And so just email me with any questions and reach out if you think you would like to learn more about nutrition because you're tired of consulting the internet and getting totally mixed messages. So with that in mind, I'm just gonna leave the my contact information here, even though, like I said, I think it's gonna be shared after the webinar. And feel free to ask any questions.
Thank you, Paula, for being a part of our webinar series. It was really, really great information. We do have one comment. I think it was regarding sort of circling back to gluten. So the individual had mentioned that there seems to be a lot of individuals that may be sensitive to gluten. Is there like a difference between gluten sensitivity and gluten intolerance?
Yeah, so the difference is that people with sensitivity, they do have symptoms, and they feel better when they avoid gluten, but there's no physical signs of damage in connection to gluten consumption. So the diagnosis is really just based on the fact that people have symptoms after eating gluten versus people with actual celiac disease. The gluten results in damaging their intestine in a way where they're unable to absorb nutrients, and it can undiagnosed celiac disease can be really dangerous, and eating gluten if you're celiac has really pretty extreme health outcomes, just because yeah, you're unable to absorb nutrients. A lot of people get diagnosed with celiac disease after losing a very large amount of weight for no reason, and that's it, that they were just not absorbing anything they were eating because of this damage. So it's just a very different disease. It's real. There seems to be a way in which people respond to gluten that just bothers them, but again, it's not as big of an effect on overall health as true celiac disease.
And we had a question come in over email during the webinar, and it was regarding probiotics, and we wanted to get your opinion on consuming whole foods like fermented berries like kefir and even things like kombucha and kimchi versus someone going to like the Walgreens and just buying a little pill box of probiotics. And I guess what they wanted to know was, is there a difference in the taste of the work and the mechanism of action?
Yeah, so that's actually a great question, because I think a lot of people, when they think probiotics, they instantly think that little box of pills versus foods. And so most of the research really finds that it should be food first, because the thing about gut health is there's so much about it out there and it's so interesting, but we really don't know what the definition of, or like exactly what composition of bacteria means healthy. All we know is that the more diverse our microbiome, the better. And so what is usually recommended is that increasing the diversity of your microbiome is best done through eating a diverse diet. And that's why I included it in this presentation, adding the prebiotics in addition to probiotics, because those are going to be extremely important to, again, increasing the diversity of your gut, feeding those gut bacteria, and really maintaining your own gut flora that you make for yourself, that nobody really knows how it's composed and why it's like that, but it's just what works for you. So yeah, probiotics in the form of a pill can be appropriate sometimes, but for most people it should be possible and even better to just maintain that gut health through a healthy diet and eating those fermented foods that really are not that hard to incorporate into the diet, and eating plenty of fibers, fruits, and vegetables. But for some people, it might not be accessible to eat a diet like that, or they might have some other gut problems that require taking a probiotic. But for anybody who's able to eat a varied diet like that, I would recommend just sticking to that.
And then we have a question here. So they're asking how much protein is recommended for breakfast, I guess more general. And then how would you overcome eating, I guess, in the morning if you have really bad nausea?
Eating in the morning if what? I'm sorry, I didn't get that.
If you have like really bad nausea.
Oh, no. Well, I think eating for nausea is usually like just try to have little bites at a time, like something that's very easy to digest, like, you know, crackers and then as time goes on, it should get better, having little sips of water, but just generally not pushing it and really just having small bites at a time is what is recommended. Nothing too hard to digest. Nothing too high in fat or so. For example, if you have nausea in the morning, I definitely wouldn't recommend having eggs or something like that. Maybe just a toast with, you know, a little bit of peanut butter and jam, something that's very light and easy and just going to be easing those symptoms. And for protein, it really depends on you as a person and your goals. Generally, I think the recommendation would be to have, I think it's about 50 grams of protein per day for a woman, but it's usually based off of your weight. So about 1 gram of protein per kilogram of body weight is recommendation. So you can see how, like, depending on how much you weigh, it's going to be so different for you. But I think anything between 5 to 15 grams should work for people, depending on where they are. I think just including some, you know, eggs or yogurt or protein powder or something like that, that's just going to be a good source of protein, as long as you're not eating a breakfast that's all carbs and fat, which is virtually impossible. You're good. So, but again, it's hard to make a general recommendation like that if I don't know more about the person and their needs, their health, their current weight, and health goals.
And then we have one more question that came in via email. And I guess they wanted to know if you have any tips or recommendations when it comes to trying to find a nutrition professional to work with. And if there's any recommendations you have just with that, I guess.
Yeah. I mean, like I said, I think it's extremely important to find somebody who is open-minded and kind of has that compassion and understanding for nobody knows your body better than you. So there's going to be a lot of people out there who push something on you. They want you to buy their program or sometimes even products or supplement, you know, like there's a lot out there in the nutrition and health coaching world that is questionable, and just really somebody who's gonna, I think the most important part when working with somebody is, will they support you and guide you through the changes that you want to make? So you're supposed to be the one who makes the rules, and the professional is supposed to be the one who supports you in reaching your goals and helps you reach them in the healthiest possible way, and kind of holds your hand. So that's supposed to be somebody who really is gonna help you reach goals, because you can't maintain something that you don't enjoy, that you don't feel like it was your decision to start it, and that you just don't feel like it's you. So yeah, finding somebody who's supportive and who's gonna ask you more questions than give you instructions.
That's all the questions I have on my end, so I'll give it a couple of minutes here just in case someone wants to type something in the Q&A or in the chat really quickly. But if not, I will go ahead and have all of your information sent out, so that way in case anyone wants to reach out to you privately with a question or concern, we'll go ahead and have your contact information. And then those that are going to be watching on YouTube, all the information for that will be down in the description box below. So it looks like there might not be another question or anything like that at this moment. So we'll go ahead and end it there. And before we leave, I just want to say thank you so much for taking your time and, you know, sort of sharing your expertise with us here on this platform. It really does mean a lot.
Sure. Thanks for having me.
Yeah, awesome. You enjoy the rest of your day.
Thanks, you too.
Mhm. Bye.